Welcome, panelists, and thank you again for your commitment to helping our viewers and readers and listeners better understand the crisis we face with this disease and how to navigate and to keep ourselves and our families safe. So let's start our conversation with Dr. Catherine Richardson. Dr. Richardson, let's talk about today's numbers. Of course, there's an update every day from the Department of Health and Environmental Control. Tell us about the numbers of infections and deaths in South Carolina.
Thanks for having me, everyone. Today, we announced 489 new confirmed cases, 43 new probable cases, 28 confirmed deaths, and 10 probable deaths. This brings the total number of confirmed cases to 131,428 and confirmed deaths to 2,968. While our daily testing numbers have been declining, I'd like to remind everyone that this virus remains widespread throughout our state. As I just said, nearly 3,000 South Carolinians have died from the virus in a matter of months.
One of the things that you have mentioned in the past, Dr. Richardson, is how COVID-19 deaths over the past 6 months compared to flu deaths over the past 10 years.
Yes, I think that helps put it into perspective that this is, it has the potential to eclipse even cancer by the end of the year. It certainly eclipsed many other known sort of leading causes of death in South Carolina so far. And this is something that we need to be taking seriously. It's certainly much more infectious and much more deadly than the flu.
Is Representative Gilliard on the phone right now?
Looks like he's muted.
Yeah, I'm here. I'm here.
Thank you so much. We understand that you are traveling, sir. We appreciate your time. We know that you just left the South Carolina State House. You introduced a bill that would give teachers and staff hazardous pay under emergency conditions. Give us an update on where we stand right now with hazardous pay.
That bill, as a reference to the state workers, will be introduced in our next session in January. As you well know, we go back in session for full session the second week in January. That's when I plan to file that bill. Now, what we did yesterday at the General Assembly, they had a Senate version of hazardous pay, but that bill only referenced our nurses, the school nurses throughout the state of South Carolina. We have not approved that yet, as of yet, but I didn't want anybody to get that bill and this bill that I will be introducing in January confused, okay? Because the bill I will introduce in January is for all state workers. Once the governor, and in my language, what I inserted, once the governor declares a state of emergency, let's say it's a hurricane, earthquake, or whatever the case might be, when he declares a state of emergency, then the pay will kick in. And I'm asking that all state workers, frontline workers who will be directly impacted, that their pay will be time and a half for whatever they're receiving at that point.
Representative Gilliard, we heard comments from Dr. Richardson with DHEC about the mortality rate in South Carolina, and we know that a third grade teacher in Richland County area, Debbie Bannister, passed away just last week, just days after she was diagnosed with COVID-19. What is your reaction to her death?
Well, when we were in session yesterday, anytime we go to the center, you see us go to the center, you call it the podium, we call it the well. That's the lingo that we use in the House. But when I took the well yesterday, I reminded the General Assembly, this thing is, if I had to put this thing on a timeline, we could go back all the way till January, okay? That's when I took the well at the State House and I informed the General Assembly, okay, that I had written the governor a letter requesting that the governor put the state of South Carolina in a precautionary mode as it pertained to this virus in China. Now, this was back in January. Now, since then, I have written the governor 3 letters, okay? You know, as we went through this, what I call pandemic, you call it, you know, it's a tragedy, because what I was telling my peers at the General Assembly back in January and in February, that this virus, as they quoted in the US News, that they caught this situation in China on the radar, okay? And I think it was you that interviewed me, Carolyn. I could be wrong, but I was quoted back then as saying that, look, when you look at China, the most populated country in the world, you know, we're talking about what we are, who we detected on the radar. The concern should be, what about the people that got under the radar? Now, this was me talking back in January in the General Assembly, and you could go to ETV. I always tell people, you know, always fact check. You know, I don't, you know, because I do videos, I keep takes, but it was somebody from ETV that actually sent me the video when I took to the well, and I told them that we need to take this virus seriously, okay? And I also challenge, it's also in the video, I challenge all of my peers in February that they should do what I was about to do. I contacted the doctors at NUSC, I contacted the law enforcement, and I actually held the first forum on the virus itself, okay? And I tell you, in that forum, we learned a lot from the doctors, because even in February at that forum, the doctors was telling us then that, look, we don't have a grip on this thing, okay? We don't even know how to handle this. And when you gain knowledge like that from doctors and experts, it only tells you one thing when it comes to letting our kids back in public schools. No, they don't need to be going into environment because we don't know what we're dealing with, okay? And we don't know how we're gonna approach the situation that pertains to the virus.
Representative Gilliard, let's allow Dr. Michael Schmidt, a microbiologist and immunologist at the Medical University, to talk about that and to talk about how this disease made its way into our communities so quickly. And we think, you know, there was so much of it that wasn't known at first, the size of the particles, how long it's airborne. Dr. Schmidt, give us more information about that, the size of the particles and why it was able to penetrate our community in so many ways so quickly, and also just so detrimentally.
Well, candidly, Carolyn, as Representative Gilliard said, this virus was under the radar. It literally came to our country on an airplane, and it spread throughout our country before we even knew it. Many of the individuals who were infected with this virus were contagious, and they spread it. We had our first cluster in the mid-state, and from there, it was, as Dr. Richardson would tell us, history. It spread pretty quickly and consistently. And to put this in perspective, this virus is small, but if you get this virus and you simply cough, the virus comes out of your cough at a speed of 26 feet a second. So this is why we're telling everyone to physically distance at least 6 feet away. The virus is very small, so gravity does not affect it as well as big stuff. We've all sneezed and hit our computer screen with our sneeze. We know sneezing is bigger particles because we see the evidence. This virus is about 560 times smaller than the thinnest human hair. So just imagine your hair the size of a massive spaghetti noodle and this little virus being the size of a pea. I mean, it's absolutely incredible. And as Representative Gilliard pointed out, the kids, and we know from time immemorial that children facilitate pandemics. Anyone who's ever had a kid in daycare know the consequences of daycare. They bring home presents for us, in the form of infectious diseases. Every new parent has had their first diarrhea case in a long while, their first cold, and Dr. Bell can probably expand on that because that's what he sees every day in his practice. And so we need to practice physical distancing. We need to be wearing our mask, putting our noses under our mask, making sure the seal is tight around our cheeks so that we, the asymptomatic who may be shedding virus, don't give it to everyone else. We have to be good citizens. We have to behave ourselves and really all pulled together. And now the country is getting together with some mitigative solutions. We're hearing talk of vaccines. We're hearing talk of new testing. And, you know, the state has really stood up well with DHEC making testing freely available to any citizen who wants it. They can find those locations easily. They have been well publicized by folks such as yourself. And so we know how to control it, but we all have to work together.
Very good points. And when you talk about some of those new methods of making it easier for testing to be done, one that comes to mind are the saliva tests. And so talk about the efficacy of saliva tests. And is it possible that if saliva tests were more readily available, that people would be tested more often? And would that be beneficial, Dr. Schmidt?
Well, the first question that you have to think about is, do we care if you are infected or do we care if you are contagious? I personally worry about if you're contagious. I love you to pieces, but I'm not concerned if you're infected unless I have to physically take care of you. I'm worried about you being contagious. So the saliva test is as good as the nasal pharyngeal swab up the nose at determining whether or not someone is contagious. And what we need to do, and we've seen our diagnostic companies really step up to the plate. They've drastically reduced the cost of frequent, easy testing. Abbott was one of the first to release it. It comes with a cute little app that can report your contacts without identifying you to the others. And it's at a price point of $5. But I would argue that that test, because it still uses a nasal swab and its cost of being $5, is still too expensive. I'm hoping for saliva at less than 50 cents. And the diagnostic companies are submitting EUA, emergency use applications, almost on a daily basis to our regulatory agency, the FDA. And I'm hopeful that within a few short months, we'll have a very inexpensive that parents will be able to administer to their child before sending them to school that will assess whether or not their child is contagious. Not whether or not they're infected, but contagious. Because if we can keep the contagious quarantined, we know that works at controlling the spread of the virus. And then we can get rid of our masks, we can get back together, we can open our restaurants wide open and return to our lives. But frequent testing needs to be a component of this solution, but it has to be inexpensive. And our diagnostic industry has really stepped up, but we have to encourage them to continue on this path.
Dr. Bell, I'd like you to interject here when we talk about testing and screenings. You have generally an older population of patients. Are those patients being tested? What are they telling you about going out and being tested and their possible exposure, especially in those cases where there may be several generations living in one household?
Well, first of all, I want to say thank you very much for having me. I certainly appreciate the opportunity. It's so good to see many of my colleagues that I've worked with in the past. In the Black community, particularly among older patients. In the beginning, the information was coming out so fast and it was so varied that a lot of the elderly population, I'm now beginning to find out, did not quite understand what COVID was all about. The information kept changing. I have a lot of patients who live by themselves. They had a lot of time, they had a difficult time understanding the information. So with that being said, unfortunately, in my practice, which is mostly African-American people, I have seen deaths in the elderly population in which they have gotten COVID from their family members. They did not quite understand that even though a patient did not have symptoms, if that patient came into their space, if it was a granddaughter, grandson, or someone else living in the house, they were capable of giving them the infection, even when they were trying to do quote unquote social distancing and sometimes wearing the mask. So unfortunately and tragically, I might add, I've already lost 2 patients, elderly patients who contracted, who was well, but contracted COVID as a result of family members visiting and trying to do their due diligence and actually infected the elderly patient. And then they subsequently got sick. They had preconditions, and then they succumbed to the COVID-19. So unfortunately, that's what I'm seeing. I have seen in my practice. Now, thankfully, that has decreased significantly. That has decreased significantly, and I think with programs like this, and with young people now understanding that they can give their grandmama something even though they are not infected, I think they're being more cautious.
I think it's very important that we stress the importance of those methods that we've heard about so many times, those things that have been very instrumental and impactful in terms of keeping us safe. And Dr. Richardson, I would like you to emphasize that, because we are hearing from some viewers about the overzealous approach, some may say, in terms of wearing face masks, that it's not necessary, despite what we just heard from Dr. Schmidt. Can you talk about what you have noticed and what you have documented through the Department of Health and Environmental Control when we've seen people starting to use those social distancing practicing, wearing face masks and being tested, where the numbers go up and down?
Well, we know that 2 factors are contributing to cases declining across the state. We know that masks are working, and we know that less people are turning out to be tested. And we already heard from Dr. Schmidt and Dr. Bell about the importance of getting tested. DHEC now recommends testing for those who are in the public, frontline workers, those who are around others who are not wearing a mask, or they might not have worn a mask themselves. They may have been in a gathering. We are recommending testing at least monthly for those people, even more so if symptoms develop or if they were known to be around a close contact. Masks, we know, work. Not only have there been studies worldwide and across the United States, but South Carolina, DHEC actually looked at those municipalities and counties with the mask ordinance and those without, and we found a significant decrease in cases in July and into August for those counties and municipalities that did have a mask ordinance in place.
We had Labor Day just a couple of weeks ago. Do you anticipate that you might see a spike in cases again, Dr. Richardson, as a result of people being close together?
Well, we hope not, but we know that that is a risk. And so, I would say again, for those who may not have practiced the social distancing that they needed to over that weekend, we would encourage them to get tested. For those who you know, we certainly know that that's a risk. We saw that with Memorial Day. We saw that with July the 4th. We know that colleges going back and schools going back in session, there's a risk of increased cases there as well. So it's really important, just as you said, to continue the same preventive measures that we have been talking about from the beginning. This is not the time to let our guard down. Hand hygiene continues to be important. Physical distancing, that's 6 feet away, if not more. Being outside is certainly preferable to being inside, and wearing a mask around the public or around others that are not in your household is extremely important for keeping not only ourselves, but our neighbors and our family members, as Dr. Bell was talking about, safe.
Thank you, Dr. Richardson. Representative Gilliard, we know that there has also been a push and people have been encouraging that we get our economy going again. What are your recommendations and what have you said to the governor about making sure that the population is protected while trying to make sure that South Carolinians are able to maintain their livelihood and that our economy is still sustained?
Well, first of all, my plea was to always listen to the medical experts, and I think when we listen to their opinions, concerns, and their guidance, I think that this economy will be on the right track. I'm a realist. I think in some areas, especially where in our counties, we look at all 46 counties, especially where they're peaking at. I think that the fact that we need to slow it down, we need to rescind on a lot of things, because when you look throughout the world, and even some of these third world countries where they have actually stopped, just pause, they had a dramatic drop in the numbers. And that's, we need to take our lessons from some of these countries. And, we have the perfect storm here, ladies and gentlemen, because when I say the perfect storm, here we are in the midst of a national election. Okay, you got everybody running for office, and this thing has, entered the political arena, whether we like it or not. And it's sad it did that because I think we're getting that tug of war to the far left, to the right, and the results is, we're not getting anywhere at this point because we're not listening to the medical experts. Okay, these are the doctors, the environmentalists. I mean, people. If we don't listen to the experts, I'm no doctor. I'm glad that Dr. Bell is. I mean, he can say things that would make a lot of sense in this area, and we should be in a position to at least adhere to some of his concerns. So that's where I'm at with this economy. If we're going to get this economy back on track, we have to have what we call backbone leadership, and it should not come from Washington. It should come here from the state, the county, the city. We need to step up to the plate and listen to the medical experts.
We know certainly that this disease has taken a toll on us in every aspect of our lives, is certainly our mental health as well. And Ms. Hayward, the Centers for Disease Control has reported an increase in suicidal ideation, people feeling depressed. What have people said to you about how they've been coping with the stress of a pandemic?
Called the time of refreshing. We have been meeting, of course, virtually, and some of the concerns that we have heard from our attendees, one, are from people who have lost a loved one to COVID. It has definitely changed the way our community grieves. We're no longer able to gather and support, and that is very, very important in the culture of African Americans. So people are being left to grieve alone, and that's been quite a big thing for us because we're used to gathering and supporting, and that helps get us through, but we're not able to do that. For other concerns that we've heard at our grief support group have been feeling very lonely, loved ones who are suffering with COVID-19 who may have to be on the ventilator and be in the hospital for periods of time. Remember, we're human. We like to be in community. and not being able to be at their bedside like we're used to being, and not being able to visit, and having to be creative with these devices to do some type of visitation. It makes people very depressed. It's causing people to be even more sad. And it's causing a lot of concerns as far as mental and emotional health.
What do you say to them? What coping strategies, what do you suggest they do to deal with some of those feelings of isolation?
The best advice that we've been able to come up with as a group and as community is we have to use the technology that we do have. If that means going by the hospital and being able to wave through the window, if it means allowing a nurse to set up FaceTime. We've had a lot of people who've been very kind enough to do that. And of course, telephone calls. And sometimes we have to get back to the good old writing a letter. We've just been encouraging people to do that. And of course, find a trusted friend or loved one or a clergy person that you can talk to when you're going through these dark times, because we were not meant to grieve alone. That's not how we were created. We have to do it in community.
I think it's also important that you remind people some of the warning signs of depression, perhaps if someone is unable to help themselves or recognize it in himself. What signs should a loved one, a workmate, a partner look for in others?
When you notice people isolating themselves, that's a sign sometimes. People will say, oh, I'm fine, or I'm okay, I just want to be by myself. Sometimes that's a sign that it's time to offer support. Most jobs have some type of mental health support on their job. They can get it through their job, and most times won't even have to pay. Offer to go with a coworker or a friend. I will take you. But a lot of the specialists are doing it, of course, virtually now. But certainly you want to encourage professional help as needed. Everyone doesn't need a psychiatrist, but everybody can make use of a trusted friend or a coworker, a neighbor. It could be something small, a porch drop off, deliver something on the porch. You know, I'm sorry about your loss, but I know I can't visit, but I wanted to leave this. We have to get creative, just let people know they're not alone.
All right, good advice. Thank you so much for that. Racial and ethnic minority groups are also struggling and certainly hit very, very hard with COVID-19. So, Ms. LaRoche, I was wondering if you could talk about how these groups can perhaps be better served, because very often they are the underserved community, and again, being hit very hard by this disease. Is Ms. LaRoche on the line? Okay. I am going to now ask Dr. Bell if you could perhaps speak to that issue about disenfranchised communities, underserved communities, and the way this disease has impacted those communities.
Well, thank you very much for the question. Unfortunately, when I began to hear some of the details about COVID-19, and I studied very closely what our Chinese colleagues were saying about who COVID-19 was affecting. It became very obvious to me very early that the African American community was going to be in trouble because the diseases that predispose people to getting COVID, if they were exposed to it, and the poor outcomes, those are the health disparities that have existed in the United States and certainly in the state of South Carolina for decades. Conditions such as diabetes, heart disease, chronic obstructive pulmonary disease, and cancer, those are just to name a few. One of the things that I did not appreciate, though, was the effect that it was going to have on the mental health and how it was going to stymie just our entire life. And so that has contributed significantly to the death rate and also the morbidity of African Americans, not only through other parts of the country, but particularly in South Carolina. And then one other thing that I began to pick up even before the news media began to talk about it. When I start seeing the morbidity and the mortality significantly increase in Chicago, in Detroit, in Louisiana, in Wisconsin, there was a common thread that ran through all of those locales. And the common thread was those people were heavily populated with African Americans. And so, and then the final thing that we don't like to talk about is the connection that racism has played in elevating the prevalence and incidence of many of the conditions that I've talked about, because the data clearly shows that in many cases, African Americans do not get the same kind of care that white people get in this country. And that's very unfortunate. That's something that that's one of those dark things that we don't like to talk about, but we have to talk about it if we are going to ever make it correct.
One of the things that I find interesting in this whole area of health disparities is the individual running for the US Senate, Jamie Harrison, talks about how his grandfather refused to seek care because he was afraid of the financial impact it would have on his family. And then he sought care when it was too late. And I'm afraid that Jamie Harrison's grandfather is not an incident of one. I think that we need to address the whole issue of health disparities, and COVID will really bring that issue into sharp focus, that we need to offer healthcare to all so that we can address the disparity and eliminate that horrible statistic of how adverse COVID is affecting the African American community as well as the Hispanic populations.
Dr. Richardson, I know that you may not have been prepared with some of this data, but I have seen some of your data in the past that makes a connection with this and shows the correlation between some segments of the population and also those who suffer greatly when infected with COVID-19.
Yes, so you're referring to some data that I shared at the City of Charleston Health and Wellness Advisory Group this past month. And one of our epidemiologists at DHAC pulled this together and showed that, you know, hospitalization rates are much increased in our Black population, 11% versus 7.5% in our white population. But the deaths also are very much disproportionately affect those who are African American, and that we see deaths at a younger age in our Black populations as compared to our white populations. And yes, much of it is what Dr. Bell is talking about, not only racism, but the comorbid conditions. But I think much of it is also related to our frontline workers have not been able to work from home. They've not been able to social distance and telecommute in the same way that many others in our communities have. And that makes it more difficult to stay safe and not bring it home to families. So I very much agree with what Dr. Bell said in his comments on disparities, and that COVID, I hope, really brings these to the forefront and allows us finally to begin confronting them head on.
Well, I feel that COVID-19 has shed a light on a lot of things that we should have been caught up on in the state of South Carolina. Because just listening to some of my friends talk, the first thing hit my mind as a lawmaker about a year ago, we had brought the nursing home issue, to the forefront as it pertains to training, staffing, security. And here the nursing homes around not only state of South Carolina, but the whole country is taking a hit because we weren't prepared for this. And we should have already caught up on the nursing home situations here in the state of South Carolina, and broadband too. Okay.
Thank you very much for that, Representative Gilliard. One of the other areas we certainly touched on teachers and touched on students returning to school, but we also should talk about college students. A couple of quick points here. Dr. Richardson, you may want to address, why is it that COVID-19 seems to more greatly impact people who are older? We hear about thousands of students on the University of South Carolina campus testing positive, but we don't hear of incidents of those students having to be hospitalized. So can you talk about how the disease impacts people who are younger, and also with students congregating, how we might in fact see the disease spread on college campuses and then eventually into the greater community?
Exactly, Carolyn. So while youth and young adults with COVID often do experience only a mild illness, that is not true for everyone. Young adults ages 20 to 21 to 30 make up 3% of all hospitalizations, and those 11 to 20 make up 1% of total COVID hospitalizations. And more importantly, as you were alluding to, young adults put older and more vulnerable people at risk with whom they might come into contact with. Even if a young adult who tests positive has mild or no symptoms, they can easily pass the virus to others who may not be so fortunate if they contract the virus. So it's essential for young people to follow quarantine and isolation recommendations made to them by a healthcare provider in order to protect their friends, family, and others in the community.
Dr. Schmidt, one of the ways that we keep enforcing and reminding people that they can, in fact, limit their exposure and exposure to those around them is by wearing masks. But masks are not created equally, are they?
No, masks are not all created equally. The types of masks that medical professionals wear when interacting with COVID-19 patients are very much different. They are the N95 mask that is very specific for excluding virus from entering into the healthcare professional. The ones that you and I are wearing out in the street are either the 3-ply cloth masks that the CDC is recommending for the general public, as well as a simple surgical mask that you can buy at the drugstores, Costco, Sam's, Walmart, that are available. Each of those masks share in common the ability to exclude the virus. They generally have a sufficient number of layers that will effectively trap the virus. The air can actually go through, but what you need to appreciate is the outside of the mask is dirty. It has literally been sucking in virus, so you have to be very careful when you take off the mask. And so as you take off your mask, you want to make sure you use the ear straps to hold it down, then lay it down and either throw it away when you're done or drop it into the laundry if it happens to be a cloth mask. The good news about COVID is soap and water works. So the first thing after you take off your mask, wash your hands. You don't need any special alcohol gels. Good old soap and water will work. And that goes for your countertop. It goes for your surfaces in your home. Soap and water will kill SARS-CoV-2, the virus responsible for COVID-19. And the masking, it's just important that you wear it according to the directions. And if your mask has a metal strip in it, make certain that it's tight around your nose. So as you exhale, those vapors are retained on the inside of the mask so that you don't run the risk of contaminating your loved ones, your neighbors, or anyone else in the community. So mask etiquette means that you wear it properly, not letting your nose hang out, because that actually places you at a greater risk because it creates a turbulent cloud of virus around your head. And then as you walk by people, they may encounter that viral cloud more easily just by the wind effect as you walk by individuals. So again, mask etiquette is paramount, and our friends at DHEC have really been driving home that message. And I'm very glad that Channel 2 and all the other news media locations are advancing this messaging to help us all stay safe.
Everyone's not receiving the message, and some people, in fact, reject it very strongly, as some people are also rejecting the idea of a vaccination and say that they will not. In fact, they think it's too soon and are concerned that this vaccination may, in fact, be rushed. So what is your suggestion, and what are your guidelines? What are your thoughts when it comes to a vaccination and a dateline of possibly the end of the year, early 21?
Well, we've heard last week that all 9 companies that will make a vaccine available to the general public of planet Earth have sworn an oath that they are not going to release a vaccine before, 1, we know it's safe for the general public. That is paramount. Safety is first. And so that means it will not cause any serious adverse reactions. The second thing they all have sworn to is that they know it's going to be effective. And we have enrolled a large number of individuals in these trials. Moderna out of Seattle, the one company that's involved with the National Institutes of Health, has enrolled over 20,000 individuals. Another company, Pfizer, has enrolled over 20,000 individuals. All of these individuals being enrolled in these vaccine studies are simply tasked with assessing, does the vaccine work and is it safe? So when those companies put their reputations of their CEOs online and say, we are not going to release it until we know it's safe and we know it works, and more importantly, our Food and Drug Administration is sworn to uphold public safety, and it's our job as the general public to hold their feet to the fire and not let them release it prematurely. But when all 10 of those groups say the vaccine's ready, I'll be the first in line to roll up my sleeve next to Dr. Bell and take the vaccine. And, you know, we really have a social responsibility as individuals to protect our neighbors. You know, it's the principal commandment that most religions follow. Love your neighbor as yourself. And, you know, we really have a social responsibility as individuals to help protect everyone. And that today means wearing masks, social distancing, and washing our hands frequently when we're out and about. And when it comes time to get the vaccine, we need to be socially responsible and roll up our sleeves.
Dr. Richardson, who should be tested and when? It seems as if the Centers for Disease Control may have changed their guidelines for testing. Who should be testing? Is it important that as many people as possible test? And how often, if someone receives a positive test or negative test, should they be tested again in a few days or weeks or months? What are the guidelines for that?
So the CDC has changed their guidelines, but DHEC is not. So we are standing behind our recommendation to test even if one does not have symptoms. So for sure, those who have symptoms should be tested. And if they're negative and they develop new symptoms, they should be tested again. Also, those who have been a close contact, so who have been identified by DHAC or another organization as being within 6 feet for 15 minutes or more, or having physical contact with someone who's positive should be tested. But we do recommend waiting 7 days from that exposure so that we have the best chance of knowing if that test is going to be positive. And then the third group is those who do not know that they have had a contact and are not symptomatic. And to those, we recommend that testing occur at least monthly for anyone who is around the public on a regular basis, anyone who cannot wear a mask all of the time or is around others who don't wear a mask. We do recommend that those folks get tested at least on a monthly basis. We have a variety of mobile testing events as well as permanent sites. Those are readily available on our website and from others such as you for putting them out there. Thank you. And so, you know, we would like to help anyone who is having difficulty finding a place to test. We would certainly like to help you to connect with that testing event. Testing is very important. Yes, as Dr. Schmidt suggested, we definitely are working with companies producing saliva tests and other options. But what we have now are very good tests that return results in less time than when things were busier earlier in the summer. So most people can get results within a few days. They're very effective. A positive test, pretty much regardless of what test you do, a positive test does mean that you are positive. That means they have very high specificity. And the more that we can have the public tested, the more that we can get those people isolated. We can notify their close contacts and have them quarantined. And that's how we're going to prevent the spread of this virus in our communities and especially in our congregate settings, whether that's nursing homes, schools, prisons, anywhere where people are close, in close contact.
Thank you, Dr. Richardson. And let's talk about schools. Representative Gilliard, at least 20 schools in the Lowcountry right now have at least one positive case of coronavirus. What is your reaction to that? And what are your concerns as far as students being together, not only students, but teachers, janitorial staff, custodians, and all associated with schools?
Oh, one is enough. I think we need to take that as an example as to how we need to proceed. You know, I'm against clustering groups. I mean, look, what are we going to wait for? 2 more people to get it? 200 more people to get it? And when you make the call, you know, I had this very same discussion with the state school superintendent, Ms. Molly Sperry, and she more or less agreed with me, but even she understands that the fact that, you know, we have to try other things and you know, and approach it from different ways. But one is enough. You know, one teacher dying in the state of South Carolina is enough. I mean, don't let's just sit around and try to turn our backs when it's written on the wall. We need to take action. I'm for bringing the kids back out of school. Let the doctors, the medical community get a grip on this thing, and then let your children go. Then let our teachers go. Then let the custodians out. But just to let them out there and knowing that we don't understand, we don't even have an idea as to when we're going to have the vaccinations, you know, ready for everybody, or what we're dealing with. You know, this is the wrong way to go. Okay. And I've heard from parents, teachers, etc. I mean, I think we're moving in the wrong direction, to be quite frank. Okay, one death is one too many.
Thank you, Representative Gilliard. Demi Bannister, that Richland County teacher who passed away days after testing positive for COVID-19. Reverend Jenkins, we certainly know that death has been a part of this disease. We've heard of too many deaths. how are you comforting families who've had to deal with death or even a diagnosis?
Yeah, you know, this has been a very, very difficult time, as you've heard Crystal talk about earlier. We're used to being able to come around each other and gather and offer that presence, that ministry of presence. And the ministry of presence during this COVID-19 has really disappeared. Folks are hospitalized by themselves. They're either at home without family being able to come around. So it's been a very, very difficult journey. Even our faith communities, you know, the disruption of in-person worship is kind of one of the most significant disruptions in the practice of religion. We have not been used to that. Although virtual ministries, you know, have been around. We've always had radio, we've always had television, you know, those things were present. But what isn't present is that we have not been able to go into our houses of worship, where the pastor is preaching by themselves, maybe a one or two persons in the service with them, and the rest of us are watching from home. So, even for our ministers, not being able to go to the homes of family members who persons are ill, or if there's been a death, it's just been totally disrupted. And so we've had to think about creative ways. We've had to use the virtual platforms, the conference calls, the cell phones, like the old fashioned way of you picking up the phone and calling people, things that we haven't done in years. And so we're doing more of that because we have to. And it worked before and is working now. And so we just have to stay engaged, stay connected, be a part of people's lives, even if we can't be present, but to offer that love and support and care.
Thank you very much, Reverend Jenkins. A couple of other quick points I want to make sure that we are able to touch on to make sure that, because we've gotten some comments from viewers, and one question that came up, and whomever would like to answer the question about a second infection. If you've had COVID, can you in fact get COVID-19 again?
The answer is yes. And it's not surprising that you can get it twice. The coronaviruses typically have been causing common colds. And as Dr. Bell well knows, you can get a common cold every year without much trouble. And it's not surprising that the SARS-CoV-2 virus is capable of reinfecting individuals. It really goes back to an old principle in that how our immune system works, and the immune system is not perfect. And consequently, when your immune system sees the SARS-CoV-2 virus, it may think it's the common cold you had 2 years ago. So it tries to fight it. So you may not get a sufficient infectious response to mount a full protective measure. So the next time you see COVID-19, you'll get sick again. But hopefully your body has learned from that first incident of SARS-CoV-2 and has learned so that your body will quickly dispatch the second infection. While you can get infected again, the question becomes how ill you become. Many of us get that second cold midwinter, and it's not as bad as the first cold that we got. And Dr. Bell sees those patients day in and day out at his practice, and he can probably expand more on that than me. Dr. Bell?
Well, you're absolutely right, my colleague. I can't explain it very much better than that, but I do want to make people aware that the reason that you need to get at least the flu vaccine. You need to get the flu vaccine because the flu and COVID will oftentimes present just alike. And if you have at least eliminated one, it improves our chances of making the diagnosis of COVID early, if in fact you are infected with COVID. Now, I want to make the public aware of one thing. There are two symptoms that people usually do not get with the flu, that they definitely get with COVID. And that is a loss of taste and a loss of smell. Otherwise, the symptoms are the same. And so if I could encourage those folk who are listening to this presentation tonight, it is very, very important to get the flu vaccine. And I also want to make you aware that the flu vaccine does not protect you against COVID. It only protects you against the flu. Now,
Okay. Very good point.
yeah. Now the rest of the information is still out as it relates to the COVID vaccine. I don't have any definitive information to say about that as of yet. I can only tell you though that when a survey was done, particularly in the African American community, African Americans are not as likely to get the COVID vaccine when it comes out because of all of the controversy that has surrounded the vaccine, and because of our legacy of getting vaccines when these kinds of controversies have been involved.
Systemic problems that have happened historically and a lack of trust in the medical community. Thank you very much for adding that. We are just about out of time, and I wanted to add that we are so grateful to each of you for lending your voices to this very important conversation tonight, your expertise. We are so grateful for it, all the great work that you are doing in the community, and we encourage you to continue doing it as well. And we also want all of our viewers to know that we have lots of information on our website, counton2.com. We have information about testing sites, information about masks, and also information as to how you can get in touch with some of the experts you heard from tonight. So again, we appreciate working with the Progressive Club of Johns Island for organizing this forum. Thank you very much for your time. We appreciate it. Stay well and good night.